Senator Cantwell.
Thank you, Mr. Chairman. Ms. Tavenner, great to see you. Thank you for our previous conversations. You know I've been very concerned about the failure to implement the basic health plan as part of 2014. I recently received a letter from Secretary Sebelius saying that no later than April 15th of 2013, you would issue a timeline for guidance, but the program would be implemented as the law states, as fully operational, with states being able to receive 95% of the tax credit value in 2015. So first I wanted to ask you, in general, wanted to ask you about your beliefs about the basic health plan. Well, what do you think is valuable about it, and your commitment to that 2013 April 15th deadline?
Yes. We are committed to the April 15th deadline, and I realize that's Monday. And so we will have information to you then, and we've started to work informally with the states in this issue. And we certainly understand that the basic health plan is an important piece of the Affordable Care Act. And so you have our commitment to implement it by January.
What do you think is important about it?
I think it gives states options for those states who want to try something innovative, and it's obviously a cost-effective strategy as well.
So you think it saves money?
I think it certainly can, but I think that's not the only reason for doing it. But I think that's an important reason. I think it also can provide a coordinated approach and quality care to
Managed care. Is that what you're saying? When you say coordinated care, do you mean managed care?
No, I mean coordinated care. But
Okay. Well, we'll look forward to seeing those guidelines then by next Monday. And just to be clear, the basic health plan for individuals, so let's take somebody who's making just over $17,000 a year who applies for this, they would save about $1,161 in health care costs for an individual. So that versus the exchange, huge savings for the individual. The Urban Institute says that if all states implemented this, this is a report that they did in 2011, if all states implemented this, we would save, the federal government would save $1.3 billion a year. So there's obviously a lot at stake for the federal government in the savings, and individual states. For example, our state would save something like $173 million per year. This is the Urban Institute who's done this analysis. So what we've accomplished here is to be able to bundle up that population that's just above the Medicaid rate, bundle them up and make them interesting where insurers weren't interested in them before. And the success of that has been able to get a better rate for individuals and to get a better, obviously, cost-effective rate both for providers, and that's why they've participated, and to get a cost-effective rate for us, the taxpayer. So I'll certainly look forward to seeing that on Monday, and certainly would love to support your nomination throughout the process, but definitely want to see this information. So thank you very much.
Thank you.